been a huge rise in at-home health tests where people can self-screen for everything from vitamin deficiencies to cholesterol levels and sperm count in the comfort of their own home.
The new at-home heart test, which costs just £20, claims it could save 136,000 lives a year by detecting those at high risk of heart problems in just 10 minutes.
So Dr. Raj is here with her advice on which DIY tests are worth investing in. This is something really new and quite innovative, actually. And since Keir Starmer did that test, the HIV test, it's really kind of promoted this.
Yeah, and it's so interesting because if you think about at-home tests, we do have some really typical ones that we've been doing for years, like pregnancy tests. You know, they're at-home sure tests that you can do.
We all got used to taking COVID tests, didn't we?
COVID tests.
Yeah.
I think after COVID, lots of these lab test companies decided to diversify into other tests you could do. So that's kind of how it started to become more popular. And the HIV test is a really interesting one because now, if you get a positive HIV test, it's actually a disease that you can, you know, get on top of and actually live a normal life with. So there's a lot of people, I think there's around 5,000 people in the UK who are undiagnosed with HIV. So, you know, think about the risks of them passing that on or living with, you know, illnesses from that. So actually promoting that, I think, is a good thing. So you can get quick test, quick result, and then get into treatment for it. So, yeah.
So we've taken a couple of tests, haven't we? I took the vitamin D test.
You did.
Kat, you took a...
Iron test.
Iron test,
yes.
Right. We made a bit of a mess of it, trying to milk the blood out. We got there in the end, and this is my result. So, I mean, it's a very simple process. Like, the pinprick was super easy.
Yeah.
You take the blood, and this is what I've got. So what are we saying here, then,
So
Raj?
what we can see here, so with vitamin D, you've got different levels that we look at generally. So you've got deficient, which is when you've got really low levels of vitamin D, and normally that will require a prescription, seeing your GP and getting some medication. Then you've got insufficient, which is what you've got on yours. So we're basically looking at the second line. There's a very faint line where it says T, and that correlates with the insufficient, which is between 10 to 30, and that tells us that your levels are not quite where we like them to be. They're a bit lower than what we'd want. So normally lifestyle advice, diet, you know, you might take an over-the-counter supplement to bring that up.
Where do you get your vitamin D usually?
Sun,
sun is one.
So with this time of year, that would stand to reason that
Maybe.
I would be lacking a bit of vitamin D?
Yeah, and actually, you know, we do recommend that between October and March, if you're at risk or you do get lower vitamin D, to take a supplement because you get less sunlight in the UK anyway. But, you know, if you are going to go away or safe, you know, if you're having safe sun exposure, you can definitely get vitamin D from that. Your diets, things like egg yolks, you know, food that's high rich in vitamin D will help with that as well. And then you can take an over-the-counter supplement, something that you can buy from your local pharmacy, you know, and they'll just say daily dose or units that you need to take per day to bring that level up just to where it needs to be.
It gives you great knowledge, doesn't it, actually? I took one for iron.
Iron, you did, yeah.
So this is mine.
So yours shows...
I'm abnormal.
Yeah.
I know.
I could have told you that before the
Which
test.
is no great shock to anybody here in the studio. Everybody's faintly nodding their head.
I mean, the simplicity of the test, and actually it's just printed on the box what you're looking for as well. It makes it very easy to diagnose, isn't it?
These tests are easy. They're user-friendly, of course. The only thing is, obviously, if you do struggle with doing the pinprick and getting the blood and etc., that might be a bit of an issue. But most people are OK with that. And if you're somebody who's, you know, checking for diabetes regularly, it's the same sort of process. And so with yours, you can see that there is an iron deficiency there. So I don't know if you knew that before. And just to say, remember, these tests they're not completely accurate. You might have false negatives or positives. So it might be that, you know, somebody might get a positive result, but actually it's not a real positive, it's false positive. Or you might get a negative result, so you're not actually negative. So
don't just because you've done one think, right, that's it.
That's it. But if you, like, I did this one last night, the ferritin test, and I am iron deficient, so I take replacement. So I was quite interested to see what it was showing. It showed that I was deficient, so it was accurate. So it's quite interesting from that point of view. But these tests are helpful, I think, if you know, especially vitamin D, if you want to, you know, get replacement or you're not sure, or you're getting symptoms of it and you want to check, you can check it.
Sorry, Kat.
Come on.
I'm deficient in vitamin D. How does that manifest itself in me? Like, because I didn't realise that. I have no idea. I don't necessarily feel any different to how I usually do.
Yes.
If I take more vitamin D, what's going to happen to me?
So if you're insufficient, which is what you are in vitamin D, you might have symptoms, you might not. So symptoms might be things like tiredness, you know, muscle aches and pains. And if you've got some of those symptoms, I mean, you know, you might be feeling tired anyway, or you might not be that, or mood changes. So if you've got those things happening, you might lend yourself to thinking, I need to check why I'm feeling tired or feeling a certain way. Now, it is a bit of a, I think, funny one, because you might not know that's what you need to test for. If you're tired, is it iron, is it vitamin D? So we're almost assuming that that's kind of what you know what to test for, first of all, when you're buying these tests. But if you don't know and you've done one, or if, you know, you think you do know, you have got symptoms, you've gone to an iron test or a vitamin D test, and it shows a deficiency or insufficiency, for yourself it's a bit easier because the guidelines are, we'll go and, you know, diet, lifestyle, But you might not know that. So again, you might have to go and see your GP anyway to say, look, I did this test. What does it show? What should I do? So it does lend yourself back into seeing the GP anyway. So sometimes it's not as helpful as it might seem to be.
Yeah.
And what about the cost of these? Because also my temptation would be, oh, I haven't quite done that right. I'll do another one just to make sure.
Yeah.
How much are these?
So they vary. So you've got some that are sort of £5 to £10, and they can go all the way up to £100+. Now, the more expensive ones, this thyroid one here, for example, is actually one that you send off to a lab.
Oh, right.
So this one is a lab test, and it is actually the kind of test you would do in a clinical setting or in a surgery. Your doctor might, or a phlebotomist might take that blood from you and then send it off. So it's probably going to be very accurate. However, you have to ensure that it's carried out, the actual test is carried out correctly for that accuracy to follow through.
See, that's the bit that I wouldn't trust in myself. Like, I'd almost... You did that one for me, but I would almost go, have I got enough blood? Have I done this? Have I done that right?
Yeah.
So it would almost... I wouldn't pay attention to the result, really, you know?
Yeah. And the ones we've done here today, actually, those are quite simple tests, but some of them are a little bit more complicated.
Difficult.
You do need to, for example, get an app or, hook it up to the app and then put in some other data in there. So if you're not tech savvy or you're not, you might not get the results per se. And also with this one here, you're sending it off to get your lab result. So where the results might be more accurate from that point of view, it might be harder to do the test itself. So there is, an up or down. With the more expensive ones, there often is a choice to speak to a doctor after as well.
Which is great.
Which is good. The other ones, so I was looking at the leaflets of all of them last night, and most of the cheaper ones do say, if your test's abnormal, go and see your doctor.
Right.
So the question is, when is a test necessary or appropriate? Because if you're going to see your doctor anyway, then maybe it's best to wait and see your doctor to see what tests you need, number one. And number two, GP wait times are up. So if you then say you did the bowel test one and it came back as positive for bowel cancer, imagine sitting there not being prepared for that, and then you're trying to get a GP appointment. That's, you haven't got the support, you might be feeling...
really intimidating.
Exactly. So I am worried about that from that perspective, because I think we need to be really mindful. We need to have more regulation around these tests. The RCGP, the Royal College, actually did put out a position statement in 2023 to NICE, the body that does all the best practice guidelines for doctors, saying that we should have more guidance around this and we should know exactly what we are looking at and what we're looking at when buying them as well, to see which test is the right one and when it's appropriate to take it.
Just not just the efficiency that we're relying on.
It's good as an add-on, I think.
Okay.
Yeah. Thank you.
Thank you.
Hello.
Thank you for visiting our This Morning YouTube channel. We upload tons of new content every single day. So hit the subscribe button, like all the videos, and don't miss out. We'll see you in the morning.